There is something that most people over the age of 65 are never told by their doctors. And it is not about a new medication. It is not about a new diet. It is actually about something that happens quietly inside the doctor's office. Something that feels completely routine, completely safe, and completely necessary. I am talking about certain medical checkups. The kind that most people assume are always a good idea. The kind that most people have been told year after year they simply must get done. But here is what the science is now telling us. And what I, as a physician and researcher who has spent decades studying how the human body heals itself, wants you to understand clearly and calmly today. Not every medical test is right for every person at every age. In fact, some of the most commonly ordered screenings and checkups can actually lead to more harm than good, especially once you pass the age of 65. That is not a frightening statement. It is an empowering one. Because when you understand the science behind what these tests actually measure, what they can miss, and what they can unnecessarily trigger, you begin to see your health in a completely new way. You begin to understand that the human body, your body, is far more intelligent, far more resilient, and far more capable of protecting itself than most conventional medical advice gives it credit for. Now, let me be absolutely clear about something before we go any further. I am not telling anyone to avoid medical care. I am not suggesting that doctors are wrong or that hospitals are dangerous. Medicine has saved millions of lives, and the relationship between a patient and their physician is one of the most important relationships a person can have. But I am a scientist, and science evolves. What was considered the gold standard in medical screening 20 years ago is not necessarily the gold standard today. New research has changed our understanding of risk, of benefit, and of what the body truly needs as we age. And it is my job and my passion to share that evolving understanding with you in plain, honest language. What I want to explore with you today is a concept that is central to everything I have studied and written about. It is the concept that the human body has its own extraordinary defense systems. Systems that fight disease. Systems that repair damaged tissue. Systems that regulate inflammation, protect blood vessels, balance hormones, and even suppress the earliest stages of cancer. These systems are real. They are biological. They are backed by decades of peer-reviewed science. And here is the most important thing. They can be strengthened, or they can be weakened. And the choices you make every single day, what you eat, how you move, how you sleep, how you manage stress, all of these choices directly influence whether your body's inner defense systems are working at full strength or quietly deteriorating. Now think about what happens when you go in for a routine medical screening. You are taking a snapshot of your body at a single moment in time. Some screenings are genuinely useful. Some save lives. But some screenings, particularly in older adults, can lead to what doctors call a cascade of interventions. You get one test. That test shows something slightly unusual. That triggers another test. That test shows something else. Suddenly, you are going through procedures, biopsies, follow-up appointments, and sometimes even surgeries for something that may never have caused any real harm in your lifetime. This is not a theory. This is documented in the medical literature. It has a name. It is called overdiagnosis. And it is one of the most underappreciated problems in modern medicine, particularly for people over 65. Let me give you a sense of how powerful this problem really is. Researchers have studied large populations of older adults and found that certain cancers, for example, are found on autopsy in people who lived long, healthy lives and never experienced a single symptom. These were cancers that grew so slowly or were so contained that the body's immune system kept them in check for decades. The people who had them did not die from them. They died of other causes entirely, at old age, without ever knowing those cells existed. The question that science now asks, and that I want you to think about today, is this: what would have happened if those cancers had been detected by a screening test? What would the treatment have been? What side effects would those treatments have caused? Would that person have lived a longer, happier, healthier life, or a shorter, more painful one? These are not hypothetical questions. They are the real questions that medical researchers, ethicists, and physicians are wrestling with right now. And the answers are leading to important changes in screening guidelines across the board. Major medical organizations in the United States, including the United States Preventive Services Task Force, have updated their recommendations for several common screenings in recent years, specifically because of what the research shows about the balance of benefit versus harm in older adults. These updates are based on careful analysis of large studies involving hundreds of thousands of patients. And what they show, again and again, is that for certain tests in certain age groups, the risk of the cascade of interventions triggered by a positive result outweighs the benefit of catching a disease early. So what I want to do today is walk you through 5 specific medical checkups or screenings that I, as a physician and researcher, would personally think very carefully about, or in many cases would choose not to get, after the age of 65. I am going to explain the science behind each one. I am going to explain what these tests are actually designed to detect, what the research shows about their effectiveness in older adults, and what the potential risks are. And most importantly, I am going to explain what you can do instead, the natural, science-backed strategies that support your body's own defense systems and actually reduce your risk of disease without any of the risks that come with unnecessary medical intervention. This is not about fear. This is about knowledge. This is about understanding your body well enough to make truly informed decisions about your health. And that is exactly the kind of empowerment I want you to feel today. Because the truth is, the most powerful medicine in the world is not sitting in a pill bottle. It is not waiting for you in a clinic. It is already inside you, working every moment of every day, ready to be supported and strengthened by the choices you make. So let us begin. Let us look at the first checkup and why the science says it may not be serving you the way you think it is. The first one on this list is prostate-specific antigen screening, commonly known as PSA testing. This blood test measures the level of a protein produced by the prostate gland. It has been used for decades as a way to detect prostate cancer early. And on the surface, that sounds like a very good thing. But the research tells a much more complicated story. The PSA test does not just detect cancer. It detects any elevation in PSA levels, which can happen for many reasons, including a benign enlarged prostate, a prostate infection, even vigorous physical activity. The test has a very high rate of what is called false positives, meaning it shows an abnormal result in people who do not actually have cancer. And when that happens, the next step is almost always a biopsy. That biopsy carries its own risks, including bleeding, infection, and urinary problems. And very often, what the biopsy finds is a slow-growing cancer that would never have caused any symptoms or shortened the person's life. Studies have followed large groups of men for over a decade and found that PSA screening does not significantly reduce the risk of dying from prostate cancer in men over 70. And the harms from unnecessary treatment, surgery, radiation, and hormone therapy are significant. They include urinary incontinence, erectile dysfunction, and serious cardiovascular complications. The United States Preventive Services Task Force currently recommends that men aged 70 and older do not routinely get PSA screening. This is not a fringe opinion. This is the consensus of a major, evidence-based medical organization. And it reflects a growing understanding in the scientific community that detecting every abnormality is not the same as improving every person's health. The second checkup I want to talk about is routine colonoscopy in adults who have already had multiple negative screenings. Now, colonoscopy is genuinely one of the most effective cancer prevention tools ever developed. It has saved countless lives. And for people who have never been screened, or who have a family history of colorectal cancer, it remains an important consideration. But for adults over 65 who have had several negative colonoscopies over the years, meaning no polyps, no abnormalities found, the evidence suggests that continuing to repeat this procedure every 10 years may offer very little additional benefit. And colonoscopy is not without risk. The preparation process can be physically demanding and dehydrating, particularly for older adults. The procedure itself carries a small but real risk of bowel perforation and serious bleeding. And for older adults on blood thinners or with heart conditions, those risks increase. There is also emerging evidence suggesting that the gut microbiome, the complex community of trillions of bacteria that live in your intestines and play a central role in immunity, inflammation, and even mental health, can be significantly disrupted by the bowel prep process, sometimes taking weeks or months to fully recover. Given the low likelihood of finding something significant in older adults with a long history of clean colonoscopies, the risk-benefit balance shifts meaningfully. I have now given you the first two items on this list, and I want you to notice something. None of this is about telling you to ignore your health. It is about being thoughtful. It is about asking the right questions. It is about understanding that more testing does not always mean more protection. And as we continue through the remaining 3 checkups, you are going to see this same theme emerge again and again. The idea that the most intelligent approach to health after 65 is not reflexive screening, but a deep understanding of your body and a commitment to supporting it from the inside out. Because the science is clear, the body's natural defense systems, its immune cells, its anti-inflammatory pathways, its ability to maintain healthy blood vessels and balanced hormones. These are the real frontline of your health protection. And they do not show up on any blood test or scan. They are built and maintained through the choices you make every single day. To truly understand why some medical screenings become less beneficial and sometimes harmful after the age of 65, you need to understand something about how the human body changes as we age. And I want to explain this clearly because this is where the real science lies. This is where the biology becomes fascinating. And this is where you start to see why supporting your body's natural systems is so much more powerful than chasing numbers on a test result. Let us start with the immune system, because this is at the heart of everything. When you are young, your immune system is extraordinarily responsive. It patrols your body continuously, identifying threats, bacteria, viruses, damaged cells, early cancer cells, and eliminating them with remarkable precision. There is a branch of your immune system called the innate immune system, which responds quickly and broadly to any perceived threat. And there is another branch called the adaptive immune system, which learns over time and develops targeted responses to specific threats. Together, these two systems form one of the most sophisticated biological defense networks ever studied. And they are always working, always scanning, always protecting. But as we age, something called immunosenescence occurs. That is a scientific term for the gradual decline in immune function that happens naturally over time. Some immune cells become less responsive. The thymus gland, which produces a type of immune cell called T cells, shrinks significantly after middle age. The balance between pro-inflammatory and anti-inflammatory signals in the body begins to shift, and a state of low-grade chronic inflammation, what researchers now call inflammaging, starts to develop. This is not acute inflammation, the kind that happens when you cut your finger and it swells up to fight infection. This is a slow, silent, persistent background level of inflammation that quietly damages tissues and organs over years and decades. Inflammaging is now understood to be a major driver of nearly every age-related disease, from heart disease to diabetes, from Alzheimer's disease to cancer. Now here is what this means for medical screening. Many of the diseases that screenings are designed to detect develop differently in older adults than they do in younger people. Tumors may grow more slowly. Blood vessel changes may be more widespread and diffuse rather than localized. And because the immune system is already working under increased strain due to inflammaging, additional stressors, like the physical demands of a medical procedure, the anxiety of a false positive result, or the side effects of an unnecessary treatment, can actually push the immune system further off balance. This is one of the reasons that the medical literature consistently shows worse outcomes in older adults who undergo aggressive treatment for slowly growing cancers compared to those who receive what is called watchful waiting or active surveillance. Let me talk about the third checkup on my list, because it connects very directly to these biological realities. That checkup is routine echocardiography, an ultrasound of the heart, ordered not because of specific symptoms, but simply as a routine annual check. The heart is one of the most important organs in the body, and heart health matters enormously. But a routine echocardiogram in an asymptomatic older adult often reveals findings that are described as abnormal, but that may be completely normal for that person's age and physiology. Things like mild valve thickening, small changes in heart chamber size, or minor reductions in pumping efficiency. These findings, taken out of context, can trigger enormous anxiety, additional testing, and sometimes even unnecessary procedures. And the procedures carry risk, particularly in older adults with other health conditions. There is something important that I want you to understand about the aging heart specifically. As we get older, the heart muscle naturally becomes slightly less elastic. The valves may develop some degree of calcification. The electrical system may slow down slightly. These are not necessarily signs of disease. They are signs of time. And the research shows that for most older adults without specific cardiac symptoms, without chest pain, without significant shortness of breath, without a history of heart attack, routine echocardiograms do not significantly reduce the risk of serious cardiac events. What does reduce risk powerfully, measurably, and without any side effects is lifestyle. Physical activity, a diet rich in heart protective nutrients, healthy sleep, and stress management have all been shown in rigorous clinical studies to reduce cardiovascular risk in older adults far more effectively than any test that simply takes a snapshot of the heart at one moment in time. The fourth checkup I want to discuss is routine annual full body CT scanning, sometimes called a body scan or total body CT. This has become increasingly popular in the United States, offered by private clinics as a kind of comprehensive internal checkup. The idea sounds appealing. Why not look at everything at once and catch anything that might be wrong? But the science here is clear and sobering. Radiation exposure from CT scans is not trivial. A single full-body CT delivers a dose of ionizing radiation roughly equivalent to several hundred chest X-rays. And ionizing radiation, accumulated over time, is itself a recognized risk factor for cancer. The more scans you get, the more radiation you accumulate. For younger adults with very specific medical needs, that risk may be justified. But for older adults who are already at higher baseline cancer risk due to aging, adding unnecessary radiation exposure is not a neutral act. It carries measurable compounding risk. Beyond the radiation concern, full-body CT scans are extraordinarily good at finding incidental abnormalities. Things that would never have caused any symptoms or health problems, but that now, because they have been seen, must be investigated. Researchers have estimated that in a typical cohort of adults undergoing full-body CT screening, the vast majority of abnormal findings are clinically insignificant. They are cysts, nodules, and minor structural variations that are simply part of the normal diversity of human anatomy. But because they have been detected, they trigger a cascade of follow-up imaging, biopsies, specialist consultations, and in some cases surgery, all for conditions that would never have required treatment. The anxiety alone that comes from being told you have a suspicious finding on a scan is a measurable health stressor. It activates the body's stress response systems, raises cortisol levels, suppresses immune function, and can significantly damage sleep and quality of life, sometimes for months while awaiting follow-up results. And now let me explain the biology of cortisol, because it connects directly to why unnecessary medical anxiety is not just emotionally unpleasant. It is physically harmful. Cortisol is the body's primary stress hormone. In short bursts, it is incredibly useful. It sharpens focus, mobilizes energy, and prepares the body to respond to a threat. But when cortisol remains elevated for extended periods, which is exactly what happens during prolonged health anxiety, it has seriously damaging effects on the body. It suppresses the immune system, making it harder for your body to fight infection and even cancer. It promotes inflammation. It damages the lining of blood vessels, contributing to cardiovascular disease. It disrupts sleep, which further impairs immune function and accelerates aging. And it interferes with insulin sensitivity, increasing the risk of type 2 diabetes. In other words, the psychological stress caused by a false positive finding on a routine scan can produce very real, measurable biological harm. This is not a minor consideration. It is a central reason why leading medical organizations consistently caution against screening tests that have high false positive rates in low-risk populations. The fifth and final checkup I want to talk about is routine thyroid screening in asymptomatic older adults. The thyroid gland, a small butterfly-shaped structure at the base of the throat, plays a central role in regulating metabolism, energy production, heart rate, body temperature, and dozens of other physiological processes. And thyroid disease is genuinely common, particularly in older women. So why would I question routine thyroid screening? Here is the reason. As we age, the normal reference range for thyroid stimulating hormone, the hormone most commonly measured in thyroid blood tests, shifts. What would be considered slightly elevated or slightly suppressed in a 40-year-old may be completely appropriate and healthy for a 75-year-old. And yet many physicians continue to apply younger adult reference ranges to older patients, leading to diagnosis of mild hypothyroidism or hyperthyroidism that may not actually require treatment. Research has found that treating mildly abnormal thyroid levels in older adults, particularly with thyroid hormone replacement therapy in the case of subclinical hypothyroidism, does not consistently improve quality of life, energy, or cognitive function. In fact, some studies have found that older adults with slightly elevated TSH levels actually have better survival outcomes than those with lower levels. An aggressive thyroid hormone treatment in older adults can increase the risk of atrial fibrillation, a dangerous heart rhythm disorder, as well as accelerate bone loss. Meanwhile, the imaging that often follows an abnormal thyroid test, ultrasound, and potentially fine needle aspiration biopsy frequently detects small thyroid nodules. Studies of autopsy data show that thyroid nodules are present in a very large percentage of the general population and are almost universally benign. But once found, they enter a cycle of surveillance and repeat imaging that can span years, consuming enormous emotional energy and healthcare resources while providing little to no meaningful benefit. I want to pause here and acknowledge something important. If you have specific symptoms, if you are experiencing unexplained weight changes, extreme fatigue, heart palpitations, or significant changes in how you feel, then thyroid testing and all of the other tests I have mentioned may be entirely appropriate for your situation. The key distinction I am drawing is between targeted testing in response to symptoms and concerns versus routine blanket screening in asymptomatic individuals. The former is good medicine. The latter, in many cases and particularly in older adults, is not supported by the best available evidence. What all 5 of these checkups have in common is that they operate on a fundamental assumption that finding something is always better than not finding it, that detecting an abnormality always improves outcomes, but biology is far more nuanced than that. The human body is not a machine that can simply be checked for faults and repaired without consequence. It is a dynamic, living system with its own intelligence. And sometimes, the most respectful and scientifically sound thing you can do is trust that intelligence. Support it. Strengthen it. Give it the tools it needs to do its job, rather than flooding it with tests, procedures, and interventions that can overwhelm it, disrupt it, and set off cascades of responses that do more harm than good. Understanding this is not a reason for passivity. It is not a reason to simply hope for the best and do nothing. Quite the opposite. Understanding this is a profound invitation to take your health seriously in a different way, in a way that is rooted in daily habits, in the science of nutrition, in the biology of inflammation, and in the extraordinary power of your body's own natural systems. And that is exactly what I want to talk about in the next part of our conversation today, because this is where the real medicine begins. Now I want to take you deeper into the biology, because I believe that when you truly understand what is happening inside your body at the cellular level, everything changes. Your relationship with food changes. Your relationship with exercise changes. Your relationship with sleep changes. And perhaps most importantly, your understanding of what it means to be healthy changes. Health is not the absence of abnormal findings on a test. Health is a dynamic, living state of balance. What scientists call homeostasis, in which all of your body's systems are working together, communicating, regulating, and repairing. And the most powerful way to protect and enhance that state of balance is not to chase it with tests and treatments. It is to nourish it every single day. Let me start with inflammation because it is the thread that connects virtually every chronic disease of aging. I mentioned inflammaging earlier, that state of low-grade, chronic, persistent inflammation that builds up over time and quietly drives disease. I want to explain how this works at the cellular level, because it is genuinely fascinating. Inside your body, there are billions of immune cells, including a type called macrophages. These cells are like the body's cleanup crew. When they detect cellular damage, foreign invaders, or debris, they release chemical signals called cytokines, proteins that trigger the inflammatory response. In the short term, this is exactly what should happen. Inflammation is your body's emergency response system. It floods damaged tissue with blood, immune cells, and repair factors. It is uncomfortable, but it is healing. The problem arises when this response is never fully turned off. When the signals that normally tell macrophages to stand down, the anti-inflammatory signals, are overwhelmed by ongoing triggers. Those triggers include processed foods high in refined sugar and industrialized seed oils, chronic psychological stress, poor sleep, physical inactivity, environmental toxins, and even certain medications. When these triggers are constant, macrophages stay in a state of low-level activation. They keep releasing inflammatory cytokines. And those cytokines, over time, damage blood vessel walls, promote insulin resistance, suppress immune surveillance of cancer cells, damage brain neurons, and accelerate the aging of virtually every tissue in the body. This is why researchers now describe inflammation not just as a component of specific diseases, but as a fundamental driver of biological aging itself. Now here is where nutrition becomes extraordinary medicine. Because certain foods, specific compounds found in plants, in fish, in certain oils and herbs and spices, have been shown in rigorous scientific studies to directly modulate the inflammatory response at the molecular level. They do not just reduce symptoms. They interact with the very genes and proteins that control whether inflammation is turned on or off. This is a field called nutrigenomics, the study of how nutrients interact with our genes. And it is one of the most exciting frontiers in modern medicine. Let me give you some specific science-backed examples. Omega-3 fatty acids found in abundance in fatty fish like wild salmon, sardines, mackerel, and anchovies are some of the most potent natural anti-inflammatory compounds ever studied. Your body converts these long-chain fatty acids, specifically EPA and DHA, into molecules called resolvins and protectins. These are the molecules that actually resolve inflammation, not just suppress it temporarily, but actively signal the immune system to stand down, clean up cellular debris, and return to a state of homeostasis. Multiple large clinical trials have shown that higher omega-3 intake is associated with significantly reduced levels of inflammatory markers in the blood, lower risk of cardiovascular disease, reduced risk of cognitive decline, and even reduced cancer risk. These are not small effects. They are substantial, measurable, and reproducible across diverse populations. Extra virgin olive oil is another extraordinary example. This is one of the most studied foods in the history of nutritional science, and for good reason. Olive oil contains a compound called oleocanthal, which has been shown to inhibit the same enzymatic pathways targeted by non-steroidal anti-inflammatory drugs. The counter-pain relievers that millions of people take every day, often with significant gastrointestinal side effects. Oleocanthal does the same thing without the side effects, and with the additional benefit of protecting blood vessels, supporting the liver, and providing powerful antioxidant protection against cellular damage. The Mediterranean diet, which places extra virgin olive oil at its center, is the most comprehensively studied dietary pattern in the world. Dozens of large studies have linked it to reduced risk of heart disease, stroke, type 2 diabetes, Alzheimer's disease, and multiple cancers. And the science shows that these benefits are driven not by any single food, but by the synergistic combination of anti-inflammatory, nutrient-dense whole foods working together to support the body's own natural defense systems. Dark leafy greens are another category of food that I want to highlight because their effects on the body go far beyond simple nutrition. Vegetables like kale, spinach, Swiss chard, arugula, broccoli, and Brussels sprouts are packed with compounds called glucosinolates and their breakdown products, including sulforaphane, indole-3, carbonyl, and diindolylmethane. These compounds have been shown in laboratory and clinical studies to activate a master regulatory protein inside your cells called NRF2. When NRF2 is activated, it switches on dozens of the body's own antioxidant and detoxification genes. It is like flipping a switch that turns on your body's internal cleanup and protection system. Sulforaphane, found in particularly high concentrations in broccoli and broccoli sprouts, has been studied as a potential cancer preventive agent, a protector of brain neurons, and a modulator of gut bacteria. And the evidence suggests that the effects are most powerful when these vegetables are eaten regularly. Not in a single large dose, but consistently as part of a daily dietary pattern. Berries deserve particular attention in any discussion of healthy aging. Blueberries, strawberries, raspberries, blackberries, and their botanical relatives contain some of the highest concentrations of polyphenols, plant compounds that have antioxidant, anti-inflammatory, and neuroprotective properties of any foods on Earth. A class of polyphenols called anthocyanins, which give berries their deep blue, red, and purple colors, have been shown to cross the blood-brain barrier and directly protect brain neurons from oxidative stress. Studies have found that older adults who consume berries regularly have measurably better memory performance, slower cognitive decline, and reduced risk of Alzheimer's disease compared to those who rarely eat them. Berries also support the health of the gut microbiome by feeding beneficial bacteria, which in turn produce short-chain fatty acids that reduce intestinal inflammation and protect the gut lining. The connection between gut health and brain health, what scientists call the gut-brain axis, is now one of the most active and exciting areas of research in all of medicine. And something as simple and enjoyable as a daily serving of mixed berries is a meaningful way to support both. I want to talk about green tea because the science behind it is remarkable. Green tea contains a polyphenol called epigallocatechin 3 gallate, or EGCG. This compound has been studied extensively in laboratory models and in human clinical trials, and the findings are consistently impressive. EGCG has been shown to inhibit angiogenesis, the process by which tumors recruit new blood vessels to feed their growth. It activates the immune system's natural killer cells, which patrol the body searching for cancer cells and destroying them. It suppresses inflammatory cytokine production. It protects the lining of blood vessels from oxidative damage. And it has been associated in population studies with lower rates of cardiovascular disease, certain cancers, and neurodegenerative disease. In Japan, where green tea consumption is among the highest in the world, rates of certain diseases are measurably lower than in populations with low green tea intake. This does not prove causation on its own, but combined with the mechanistic data from laboratory studies, the picture is compelling and consistent. Physical movement is another pillar of the body's natural defense system, and its effects on health after 65 are so profound that if exercise could be bottled as a pill, it would be the most prescribed medication in history. Regular aerobic exercise, walking, swimming, cycling, dancing, increases blood flow to every organ in the body, including the brain. It stimulates the production of a protein called brain-derived neurotrophic factor, or BDNF, which promotes the growth of new neurons and synaptic connections in the hippocampus, the brain region most critical for memory and learning. Exercise reduces circulating levels of inflammatory cytokines. It improves insulin sensitivity, protecting against type 2 diabetes. It strengthens the heart muscle and improves the elasticity of blood vessels. It supports healthy body weight, which reduces the metabolic load on every organ system. And it activates the lymphatic system, which is the body's drainage network for immune cells and cellular waste products. Every single time you take a brisk 30-minute walk, you are performing something that no medical scan or test can replicate. You are activating and supporting the body's most fundamental self-healing mechanisms. Sleep is the third pillar I want to emphasize because it is profoundly underappreciated in discussions of health after 65. During deep sleep, particularly the slow wave and REM stages, the brain activates a recently discovered waste clearance system called the glymphatic system. This system uses cerebrospinal fluid to flush out metabolic waste products from the brain, including a protein called amyloid beta, which is one of the key proteins that accumulates in the brains of Alzheimer's patients. In other words, sleep is not just rest. Sleep is when the brain cleans itself, and chronic sleep deprivation, even just losing 1 to 2 hours per night consistently, impairs this cleaning process, allowing waste products to build up. Sleep deprivation also raises cortisol levels, suppresses immune function, increases inflammatory markers, impairs blood sugar regulation, and accelerates cellular aging. There is no supplement, no screening test, and no medical procedure that can compensate for chronically poor sleep. The body requires it. The brain demands it. And making sleep a priority is one of the most scientifically sound health decisions a person can make at any age, but especially after 65. Stress management is the fourth pillar, and I want to connect it back to something very specific. Earlier in our conversation, I talked about how unnecessary medical anxiety, triggered by false positive test results, can activate the stress response and raise cortisol levels, causing real biological harm. The same principle applies to chronic life stress from any source. Loneliness, financial worry, grief, relationship conflict, or even the constant stimulation of 24-hour news cycles all activate the same cortisol pathways. And those pathways, when chronically activated, suppress immunity, promote inflammation, damage blood vessels, and accelerate aging. Social connection, real, warm, face-to-face human interaction, has been shown in landmark studies to be one of the most powerful predictors of longevity in older adults. People with strong social networks have lower rates of virtually every chronic disease, including heart disease, dementia, and cancer. The biology behind this is real. Social connection reduces cortisol, increases oxytocin, a hormone that promotes healing and immune regulation, and activates the parasympathetic nervous system, the rest and repair state that is the biological opposite of the stress response. Being loved, belonging to a community, laughing with friends, these are not luxuries. They are medicine. I want to spend this part of our conversation going even deeper into the specific biological mechanisms that make lifestyle choices so powerful. Because this is where science truly becomes life-changing. When people understand the actual biological processes at work, they do not just know what to do. They understand why it matters at the deepest possible level. And that understanding is what makes lasting change possible. Let me talk about the endothelium, because this is one of the most underappreciated tissues in the entire human body. The endothelium is the single cell, thick lining that coats the inside of every blood vessel in your body, from the large arteries that carry blood away from the heart, to the microscopic capillaries that deliver oxygen and nutrients to every single cell in every single organ. Laid flat, your endothelial cells would cover an area roughly the size of a tennis court. And this tissue is not just a passive lining. It is a dynamic, hormonally active organ in its own right. Endothelial cells produce nitric oxide, a gas molecule that causes blood vessels to relax and widen, improving blood flow, lowering blood pressure, and preventing the formation of dangerous blood clots. They regulate the movement of immune cells in and out of tissues. They control the growth of new blood vessels, a process called angiogenesis, which is critical for healing wounds, but which can also, if dysregulated, feed the growth of tumors. When the endothelium is healthy, it performs all of these functions beautifully. But when it is damaged by chronic inflammation, by high blood sugar, by oxidized fats from processed foods, by cigarette smoke, by chronic stress, it becomes dysfunctional. It stops producing adequate nitric oxide. It becomes inflamed and sticky, allowing LDL cholesterol particles to embed in the vessel wall and trigger the formation of plaques. This is the biological beginning of atherosclerosis, the process that ultimately leads to heart attack and stroke. And here is the critically important thing: this process is not inevitable. It is not simply what happens when you get old. It is driven by specific, modifiable lifestyle factors, and it can be slowed, halted, and in some cases even partially reversed through diet and lifestyle changes. Foods that support endothelial health are among the most powerful cardiovascular medicines in existence. Nitrate-rich vegetables, including beets, spinach, arugula, and Swiss chard, provide dietary nitrates that the body converts into nitric oxide, directly supporting endothelial function and blood vessel relaxation. Studies have shown that regular consumption of beet juice or nitrate-rich vegetables measurably lowers blood pressure, improves exercise performance, and enhances blood flow to the brain. Dark chocolate, at least 70% cacao, contains flavonols that activate nitric oxide production in endothelial cells. Multiple clinical studies have demonstrated that regular dark chocolate consumption improves arterial flexibility, reduces blood pressure, and decreases markers of inflammation. Pomegranate, rich in a polyphenol called punicalagin, has been shown to reduce the oxidation of LDL cholesterol, one of the key steps in plaque formation, and may help maintain the elasticity of arterial walls. Now let me talk about the gut microbiome in more depth, because this is arguably the most exciting frontier in all of health science right now. Inside your intestines live approximately 38 trillion microorganisms, bacteria, fungi, viruses, and other microscopic life forms that collectively make up your gut microbiome. This community of organisms is so vast, so complex, and so intimately connected to every aspect of your health that scientists now refer to it as a virtual organ. And like any organ, it can be healthy or it can be damaged. It can be diverse and flourishing, or it can be depleted and imbalanced, a state called dysbiosis.